Our next guest is Ron Bachman. He's president and CEO of Healthcare Visions. He was principal at Price Waterhouse in his former career, and he's worked on healthcare policy issues and market transformation ideas as far back as the Bush administration, and now has crossed the aisle and worked with the Carter Center, Senator Kennedy, and Senator Wellstone, specifically on mental health issues. Important for Atlanta is he's a Georgia Tech graduate and is an actuary. So that means that you were a mathematician.
I did. I graduated from Georgia Tech with a degree in applied mathematics, and then ultimately Georgia State in a master's degree in actuarial science.
Well, I almost went that way. I was a math major as well, and just could never get into that. It was science without formaldehyde, and I always wanted to be an ENT doctor. But we're glad to have you on the show.
Glad to be here.
Well, so tell me, what do you do as president and CEO of Healthcare Visions? What does Healthcare Visions do?
Well, I have three passions in life. My missions in life really are: one, to solve the uninsured problem with free market solutions; two, to expand mental health benefits. I've worked in that area for many years. And three, to promote what I call healthcare consumerism, that is, getting people engaged in their own health and healthcare decision making.
So what is healthcare consumerism as you define it?
Healthcare consumerism is empowering people in two specific ways: empowering them financially so that they have a stake in the game, and empowering them with information. And many solution providers, if you will, out there, wellness companies, tend to only do one or the other, but the best do both. Some people just provide information about how they should make decisions around their health or health care. But really what we're finding is that people have to have a stake in the game. You know, if somebody else is paying the bill, you really don't pay much attention. There's an old saying, nobody washes a rented car.
That's true. I think that being in charge of your healthcare dollar is empowering. And consumerism is here to stay in healthcare. And I would say that we're returning to previous times in the 1960s where you had major medical and you were responsible for the large majority of the cost of your health care. And I believe we're headed that way again. Do you think that's true?
We are. There's a little bit of a back to the future with getting people engaged. But, we never really have had a lot of responsibility for our own health care. We rely on the doctors to tell us what to do, and the insurance companies pay for almost everything. We don't have as much out-of-pocket costs. So actual out-of-pocket costs over the years, while people complain about I have to pay for this or that, have really been fairly minor. And, in the past when we had $10 copays, the baby boomer generation going through this whole historic period here really didn't care. When they could get $10 babies, they could have office visits for $10, they can get a prescription drug for $10. But now as they're getting older and they're having more significant conditions, they really want to have more of a stake in the game. They really want to have more voice in the game and don't want to just follow what everybody else is telling them they have to do. They want to control their music on their iPad. They want to use iTunes. They want to buy and sell stocks on their own. They pump their own gas. They do all these things to take control of their own life. They don't like other people telling them what to do. And we're really getting that into healthcare now. So it is a little bit of back to the future. But, back in the 1960s, we really didn't have the high technology that drove up costs and all the different options and choices we have today. So it is a little bit of back to the future, but it's really where we're going with healthcare consumerism that matters right now.
Well, you developed a consumerism grid,
Mm-hmm.
and that should help patients understand better, what is healthcare consumerism and how it will affect them. Tell us about this consumerism grid.
Well, let me see if I can paint the picture. It's a little hard on a radio program to paint a picture as opposed to holding it up if it was visual out there, but it's pretty easy to think through. Healthcare consumerism is what I call a mega trend. You can't stop it. Government regulations can't stop it. It's an idea so powerful that it's going to happen no matter what. Now, elections do matter. They can speed up or slow down mega trends, but they can't really stop them. And so healthcare consumerism is what I call a mega trend. And here's what's happening if you think about different generations of where we've been, where we are, and where we're going. And I have 5 generations that I identify in that process. The first generation is what I would call just the high deductible plans. They're the basic type of consumerism products that came out several years ago. Those were the first generation. They were actually subject to a lot of criticism that they were only for the young and the healthy and the wealthy.
Are these high deductible plans for major medical?
They are high deductible plans, but that's first generation. Second generation, I really hate the term high deductible plans because in a second generation product concept, you actually can have rewards and incentives and financial monies coming into an account that actually fill up the deductible. So if you're doing the right things and getting rewarded and incentivized, you may not have any out-of-pocket cost, even though we call those high deductible plans. Because if you're diabetic and you're doing the right things, you're going to not have to be hospitalized as frequently as somebody who's not taking care of themselves. You won't have as many medications. And so an insurance company or your employer, if it's a self-insured plan, should provide shared savings. Give some of that savings back because you're doing the right things. And if they give that shared savings back to you, they can actually fill up that deductible gap you would otherwise have. So the term high deductible plan really is a bad term. The only reason we have it is because that first generation product was actually codified in federal legislation, and they defined it legally as a high deductible health plan. But we've moved well beyond that exposure to individuals with high costs by getting them engaged, and those who do the right things don't have that high cost.
Once again, we're talking to Ron Bachman, President and CEO of Healthcare Visions. Ron, let's talk about one of your other passions as well, because it is a consumerism, but something we can't help is mental health. There are mental health issues. And how do you see these trends affecting mental health coverage?
Well, mental health has been a passion of mine for a long time. I guess most people involved in the mental health area have either had a personal experience or a family experience with it. And I've worked across political lines. I get political whiplash because I've worked with Newt Gingrich on healthcare reform issues, was a senior fellow at his Center for Health Transformation, and I've worked with Ted Kennedy and Patrick Kennedy in Washington on getting mental health legislation passed so that people with mental illnesses are treated the same as people who have other illnesses. You can't really separate mind and body. For example, if you have a diabetic who's not taking their medication, they're non-compliant, and they're not getting better, well, in many cases it's because they're suffering from depression. And if you don't treat the depression, you'll never get them to be compliant with care and treatment. So you can't separate mind and body out. And,
no, you can't.
And over the
I
years,
see it in my practice all the time.
Absolutely.
Half of it's psychology.
It is, and I think with the best kinds of integrated practices these days is recognizing that reality and including mental health analysis along with the physical analysis and trying to be sure both are being treated fairly and properly. I probably testified in 35 states being sure that mental health parity was passed at the state level and ultimately helped pass it at the federal level.
With regard to consumerism, I believe that people will now be shopping for their medical services, even though they have insurance, because the deductibles are out of pocket. Let's just say out of pocket, whether it's the cost of insurance, deductible, co-pays, co-insurance is so high that we're going to be forced into that. And part of that is healthcare consumerism, at least as I define it.
I agree with that. But I think what's happening out there is that people want to know about the information about what things cost, what's the quality, what's the service, where do I go, what are my options. And I think the provider community is really coming around to being more open. You know, the term is transparency.
Yes.
But, you know, I really don't like that term. That's sort of an insider's term. What does transparency mean?
Well, it seems to be a popular term right now.
It is, but you know, you can argue about transparency. You can say, I'm not going to share that price with you, that cost, because it's proprietary. So hospitals don't want to share what their real costs are.
Well, I think they should.
They should, but here's the way to turn the argument.
Tell me.
Instead of using the word transparency, use the word the right to know. A patient has the right to know what the cost is. He has the right to know what the quality is going to be. Instead of saying, well, I want transparency, you know, say, you can argue about that, but you can't really argue about the right to know.
The right to know. Well, who would buy a car, right, without knowing what it costs?
Exactly.
No one, or a pair of shoes, anything, and that's why it is consumerism.
Yes.
And there are some things that can't be just consumerism. Real quickly, in about a minute that we have left, anything you want to say about how this reform affects Medicaid and Medicare?
Well, I think on the Medicaid, which is insurance for the poor, there's a great experiment going on in the country because half the states have expanded Medicaid under the Obamacare and half have not, given the choice by the Supreme Court. And in some ways, it's a political argument. Are we going to have a dependency society, a dependency state that gives all sorts of benefits, welfare and health care and everything else, housing and Obamacare phones? Or are we going to have a state that creates jobs and gets people working? And if you want to not work and have all these other benefits, then you might we'll see migration from one state to another. That doesn't say that everybody on Medicaid doesn't want to work. A lot of people are very needy, and the real issue is, can we keep the money concentrated on those who have real needs as opposed to those who are just kind of playing the system?
Wow. Well, thanks for being with us, Ron. I appreciate it. Hope you'll
Glad
come
to be
back
here.
to the show. Coming up next, I'm going to tell you about a healthcare issue that all families deal with and how you can best treat your child and yourself should you have this condition. You're listening to Doc Talk with Dr. Jeffrey Gallups on Talk Radio 640 WGST.